Hi everyone, today I'm going to explain the physiologic classification of anemia. So right now I'm not talking about any kind of other classification, but rather the physiologic, which means it's based on physiology. So we have two big categories. At the first, reticulocyte index, which is less than 2.5, and reticulocyte index, which is more than 2.5. So these are the big categories, and we're gonna do the next upon these. Once it is less than 2.5, it's considered as hypoproliferative anemia hypo. But once it exceeds 2.5, it's considered as hyperproliferative. Hypoproliferative, as well, it categorized microcytic less than 80, which means the MCV, normocytic between 80 to 100, and macrocytic more than 80 in terms of MCV. So these all are considered as hypoproliferative, which means the reticulocyte index is going to be less than 2.5, which means less reticulocytes are produced, so no many of reticulocytes. Okay, the microcytic, it could be iron deficiency anemia, it could be thalassemia, which less than 80 of MCV, anemia of inflammation, sideroblastic anemia, and lead poisoning. So all of these are hypoproliferative, and as well they are microcytic, which less than 80 MCV. I mean, in terms of the size. Normocytic from 80 to 100, anemia of inflammation, renal failure, and marrow failure. So anemia of inflammation is the size is normal, renal failure the size is normal, and the marrow failure the size is normal. So it means the chronic diseases are accompanied with the normal size. And the macrocytic more than 80 MCV, we have B12 deficiency, alcoholic liver diseases, hypothyroidism, and myelodysplasia. All of these considered as macro, which means more than 80, and they are hypoproliferative. The reticulocyte less than 2.5 once you got it in the blood check. The reticulocyte index more than 2.5, hyperproliferative, mostly either hemolysis or acute blood loss, because in either cases the reticulocyte going to be high in number. So you have high, so hemolysis, such immunodestruction, it could be any kind, genetic destruction of the hemoglobin, red cell enzymopathy or membranopathy, any kind of disease, thrombotic microangiopathy, and which is like in the process of the thrombosis and coagulation disease, and kind of these drugs, toxin, trauma, mechanic heart valves, all could cause hemolysis. And lastly, the acute blood loss, because the body wants to compensate the loss, so he starts to produce more reticulocytes. So to recap, this is the physiologic classification of anemia. They're less than 2.5 reticulocyte, and more than 2.5. It could be hypoproliferative or hyperproliferative, and hypo has these categories according to the MCV. In just the hyperproliferative, either hemolysis or acute blood loss.